Assalamualaikum warahmatullahi wabarakatuh. My name is Laila Hasanah. I'm from Biology Department of Ring A, Malang University. Here, I will explain about an articles that tell us about Circumsion Stop HIV. But I will explain about HIV before. I'm sure that all of you know about HIV, right? Yeah, HIV, also called immunodeficiency virus. It attack our body, and especially CD4 cells, or usually called T cells in our body system, in our immune body system. And then the virus transmitted through blood, contact infected blood, semen, or vagina fluid, and also transmitted by mother to child. Yes, mother to child, and then needle or other sub-object. And then within a few weeks of HIV infected, flu-like symptoms such as fever, sore throat, and night sweat, and what else? Another symptoms can be occur. And then now I will tell circumcision preventing HIV. In 2007, trials first began to show that men who had been circumcised are significantly less likely to contract HIV. Compared with the uncircumcised individuals, the HIV infections rate was up to 80% lower in the individuals who had their foreign skin removed. And then this study is doing in the areas that have a big population, people who infected by HIV. One of these areas is Zimbabwe, where in the 1990s, about one-third the population was HIV infected. Today it's about 14th as the impact of the circumcision. And then how the circumcision can preventing with HIV. So, plant has a foreign skin. That in the foreign skin has an enzyme that can use for immune. If the foreign skin not cut off, the enzyme will be focused to attack a bacteria. But if the foreign skin was cut off, the enzyme will be focused to attack a virus. So, circumcision can preventing HIV virus to come in our body. If 80 until 90% of the male population could participate in the benefits program would be very much. And there are also additional returns that the cost of the program is offset by the money saved for antiretroviral drugs. However, what will be the strategy when the target level is reached and about the focus on targeting adolescents and men in their early 20s and on promoting newborn circumcision? That is being debated right now. Circumcision is simpler and cheaper, with fewer side effects when done in the neonatal period, but the system is very much used for older age group, and to change the target, it's made the math success. From mathematical methods that constructed by Jessica McGillen and her colleagues, which they have calibrated using household survey data on prevalence and risk behavior, as well as circumcision coverage data. The result is more than 1 million men have undergone circumcision in country. The preventing HIV in the regions of 80 causes of HIV so far. As author John Stiffer suggests, this number will predicted to over 500,000 cases of HIV prevented over the next 50 years, since many of the participants in the voluntary medical male circumcision program were not yet sexually active. But uptake of circumcision was initially slightly slower than expected over the uncertainty around the procedure. Consequently, the date to reach the 80% target has been pushed back to 2021. The conclusion: HIV is a virus spread through certain body fluids that attacks the body immune system, especially the CD4 cells, often called T cells. This damage to the immune system makes it harder and harder for the body to fight off infection and some other diseases. Transmit HIV only through specific activities. Most commonly, people get or transmit HIV through sexual behavior and needle use. Alongside education and safe sex message, and until an effective vaccine is produced, circumcision remains the most effective tool we have in combating one of the worst pandemics to afflict the human race. Okay, I think that's it, and sorry for the mistake. Assalamualaikum warahmatullahi wabarakatuh.